No one knew the night ER nurse served in the army until armed gunmen stormed the Korean Mafia boss's ward. The blood pressure monitor screaming at 2:13 a.m. in St. Michael's ER wasn't the alarm anyone expected. And the woman who stepped between a rifle barrel and a sedated Korean Mafia boss, moving with the calm precision of someone who'd done this before, wasn't just a night nurse. For 8 months, the staff thought Charlize was the quiet one who restocked carts, kept her head down, and never caused problems. They thought she was timid. They thought she was forgettable. They were dangerously wrong. When an armed man stormed the corridor demanding a sedated patient wake up and unlock what he stole, he thought he controlled the room. He didn't know the tired nurse standing near the medication cart had already counted the exits, mapped his stance, and spotted the second threat he hadn't seen yet. This is the story of the night. A gunman learned the difference between controlling a room and surviving one. It was a Monday in January when the city never quite settled, a restless hum of distant sirens and emergency lights painting the glass facade of St. Michael's Hospital in rotating red and blue. Inside on the emergency wing, the air smelled of floor wax, coffee that had been sitting too long, and the sharp tang of antiseptic that never quite left your nose. It was the graveyard shift, the dead hours. Charlize sat at the nurse's station, the pale glow of the computer monitor reflecting in her steady, watchful eyes. To the casual observer, Charlize was invisible. She was 32, with dark hair pulled back into a practical ponytail. She moved efficiently, but quietly, shoulders slightly hunched as if trying to take up less space. She spoke in a low voice. She never argued with doctors. She never joined the gossip. "I swear she's a robot," whispered one of the younger nurses during a lull, scrolling through her phone. "I asked her what she did last weekend, and she said meal prep. Who meal preps for 2 days straight?" Dr. Elias, the attending physician on call, didn't even look up from his charts. He was brilliant, precise, and exhausted from back-to-back shifts. "As long as she preps the meds correctly, I don't care if she alphabetizes her closet. Just keep her efficient." Elias was good at his job, but he didn't notice things about people like Charlize. He didn't notice that while she walked quietly, her steps never made unnecessary sound. He didn't notice that when a door slammed 3 rooms down, Charlize didn't startle. She shifted her weight subtly to the balls of her feet, her eyes tracking the source before anyone else registered it. He didn't notice the faint scar running along her right forearm, usually hidden beneath her scrub sleeve. Charlize typed her notes. Patient in Ward C stable. Vitals normal. IV replaced. She wasn't bored. She was vigilant. Old training didn't disappear. It just went dormant. 7 years ago, Charlize wasn't checking vitals in a quiet hospital corridor. She was Specialist Charlize Reeves, attached to a medical support unit working alongside combat engineers in Kandahar Province, Afghanistan. She had triaged field casualties under mortar fire. She had kept soldiers alive while waiting for medevac helicopters that sometimes didn't come. She had learned that the difference between survival and disaster was often just staying calm when everyone else was losing their minds. She'd left that life behind. Or so she told herself. "Hey, Charlize," called Kathy, the beloved night volunteer who seemed to know everyone's favorite snack and always had a kind word ready. "Can you check on the patient in Ward C, the one who came in earlier with the security detail?" Charlize looked up, her expression neutral. "The nightclub owner?" Kathy nodded, lowering her voice. "She woo. 2 men in suits came with him. They're not saying much, but everyone's whispering he's connected to, you know, Korean Mafia," the rumor went. Charlize didn't care about rumors. She cared about vitals, allergies, medications, and who might try something stupid when they thought nobody was looking. "I'll check on him," Charlize said quietly. She stood up, no wasted movement, and grabbed the medication cart. Her forearms flexed briefly as she maneuvered it down the corridor, cords of unexpected strength rippling under her pale skin before she hunched her shoulders again, hiding what she was capable of. As she approached Ward C, she heard it, a sound that didn't belong, not the squeak of gurney wheels, not the beep of a monitor alarm, the metallic hiss of automatic doors opening at the far end of the corridor, followed by footsteps that moved with purpose. Charlize stopped. The shuffle vanished. Her spine straightened slightly. Her breathing slowed. She turned her head just enough to see a man in a dark mask, heavy boots, and a rifle held low and ready, like someone who knew exactly how to use it. Charlize's blood went cold. Then immediately turned to fire. She stepped backward, positioning the medication cart between herself and the open corridor, leaving herself a narrow line of sight through the gap between supply shelves. Through that sliver of space, she watched. The masked man didn't rush. He moved with deliberate, practiced steps, scanning corners, checking angles. This wasn't rage. This wasn't impulse. This was tactical. Charlize glanced at her wrist. No smartwatch, just an old, battered field watch. 2:13 a.m. She touched her pocket. Her phone was back at the nurse's station, plugged into the charger. She was unarmed. She was in a narrow corridor, and a wolf had just walked into the ER. The silence shattered, not with a scream, but with a voice that cut through the air like a blade. Phones down, hands where I can see them. Nobody's a hero tonight. Charlize didn't move from behind the medication cart. From her position, she could see the masked man clearly now. 6 feet tall, black tactical gloves, rifle held with the kind of confidence that came from practice, not movies. His head swiveled methodically, scanning faces, counting bodies. Down the corridor, she saw Dr. Elias freeze mid-step, his hand still holding a patient chart. A younger nurse, the one who'd been scrolling through her phone moments ago, stood paralyzed near the supply closet, her face drained of color. The gunman moved toward them, his boots heavy against the tile. "I said phones down," he repeated, voice flat and controlled. "You don't want me to ask twice." The young nurse's phone clattered to the floor. Charlize watched the way the gunman tracked the sound, instantly, precisely. His training was showing. This wasn't a panicked amateur. This was someone who'd planned this moment. She needed to see more, needed to understand what he wanted before she could figure out how to break his control. Slowly, deliberately, Charlize stepped out from behind the cart, her hands raised to shoulder height, palms open. She kept her shoulders hunched, her movements small and unthreatening. The gunman's head snapped toward her. "You," he said. "Get over here with the others." Charlize moved carefully, her eyes downcast, shuffling like someone who'd never been in a crisis before. As she walked, she counted. 4 staff members visible, 2 patients in rooms with open doors, 1 security camera in the corner. Likely monitored, possibly already triggering silent alarms. She joined Elias and the others near the nurse's station. The gunman positioned himself at the center of the corridor, controlling all sightlines. He gestured toward Ward C with the rifle barrel. "The patient in there. Shiwu, wake him up." Elias stepped forward slightly, his voice steady but tense. "I'm Dr. Elias, the attending physician. That patient is sedated for medical reasons. I didn't ask for a lecture, doctor," the gunman cut him off. "I asked you to wake him up. He has something that belongs to me, something he locked away, and he's going to unlock it tonight." Elias opened his mouth to argue, but Charlize could see it in the gunman's stance, the way his grip tightened, the way his weight shifted forward. Authority wasn't going to work here. Authority was just another target. She spoke before Elias could make it worse. "Sedation doesn't work like a light switch," Charlize said quietly, her voice calm and factual.
Please, lower the weapon. We're
If we
here
rush
to
it,
help.
his blood pressure could spike or drop. He could seize. He could stop breathing. She paused, letting that sink in. "If you want him awake enough to talk and alive enough to unlock whatever you need, it takes time. A few minutes, maybe 10. The gunman's masked face turned toward her. She saw his eyes, dark, calculating, weighing her words. "You a doctor?" he asked. "Nurse," Charlize said. "I manage sedation protocols every shift. I can wake him up safely, but I need you to let me do it the right way, or you won't get what you came for." She wasn't begging. She wasn't panicking. She was offering him a path to his goal, framing herself as useful, not an obstacle. The gunman stared at her for 3 long seconds. Then he nodded once. "You've got 10 minutes. Anyone moves wrong, someone dies, starting with her." He gestured toward the young nurse, who let out a choked sob. Charlize nodded slowly. "Understood." As she moved toward the medication cart, she caught Elias's eye and gave the smallest shake of her head. "Don't argue. Not now." Elias's jaw tightened, but he stayed silent. Then, from the far end of the corridor, a soft voice broke the tension. "Baby, you don't want to do this in a hospital." Everyone turned. Kathy stood near the wall by the linen closet, her hands visible, her posture non-threatening. She'd been restocking blankets when the gunman arrived, and now she spoke with the gentle firmness of someone who'd spent decades talking frightened people down from ledges. Hospitals have cameras, Kathy continued, her tone warm but serious. They have security. They have systems. Whatever you're angry about, whatever he took from you, this way won't get it back. It'll just take your future too. The gunman's rifle swung toward her. Get away from the door. Kathy didn't flinch. She stepped slowly along the wall, away from the exit, closer to the others, but her eyes never left his. You came here angry, she said softly. But you're not stupid. So don't act stupid. For a heartbeat, the gunman hesitated. In that moment, Charlize caught Kathy's eye and gave the subtlest signal. 2 fingers lowered toward the floor. Stay low. Stay near the wall. Kathy understood without understanding why. She shifted her position, putting herself behind the corner of the nurse's station, out of direct line of fire. The gunman turned back to Charlize. 10 minutes. Move. Charlize approached toward C's door, her hands steady as she reached for the handle. And then she saw it. Through the small window in the door, Shiwoo's eyelids fluttered. Just barely. A micro movement.
You don't have
easy
to do
to
this.
miss unless you'd been trained to watch for signs of consciousness in wounded soldiers pretending to be unconscious to avoid enemy attention. He wasn't fully sedated. He was aware. Charlize's pulse quickened, but her face remained blank. The gunman leaned closer to the door, his voice dropping to something colder. Wake him up, he said, or I do it my way. Charlize pushed the door open, stepping into the room where a man rumored to be a Korean Mafia boss lay watching her through half-closed eyes, and where the real danger was about to begin. Inside Ward C, the air was thick with the smell of disinfectant and the steady beep of the heart monitor. Shiwoo lay on the hospital bed, IV lines running from his arm, his face pale against the white pillow. His eyes were closed, but Charlize had seen that flutter. She knew better. The gunman stepped into the room behind her, keeping distance but maintaining control. The rifle stayed raised, tracking her movements. Wake him, he ordered. Charlize moved to the bedside, her hands visible, her movements deliberate. She checked the IV drip, adjusted the monitor, buying seconds, reading the room. Shiwoo, she said quietly, her tone clinical. Can you hear me? Nothing. The gunman shifted impatiently. I said wake him up. Charlize kept her voice steady. His vitals show he's coming out of sedation naturally. If I push stimulants too fast, his heart... I don't care about his heart, the gunman snapped. I care about what he locked. Then Shiwoo's lips parted. His voice came out thin, barely a whisper. No. Call. The gunman stepped closer instantly, the rifle lowering slightly as he leaned in. What did you say? Shiwoo's eyes opened. Dark, focused, and far more aware than someone freshly sedated should be. No. Call, he repeated, each word deliberate. The gunman's jaw tightened beneath the mask. You're going to make a call, Shiwoo. You're going to unlock the account. You're going to give back what you stole, or everyone in this hallway dies. Starting with the pretty nurse here. Charlize didn't react to the threat. Instead, she spoke, her tone calm and measured, like she was negotiating a medication dosage, not a life. Before this gets worse, she said, looking directly at the gunman. Tell me what you actually need. Not what you're angry about. What's the outcome you came here for? The gunman's head turned toward her sharply. What? You want him to unlock something, Charlize said. That means you need him conscious, cooperative, and alive. Those 3 things don't happen if you're pointing a rifle at his face. So what do you actually need him to do? For a moment, the gunman said nothing. Then his voice came out lower, tight with barely controlled frustration. He stole access codes, digital keys, locked them behind biometric authentication only he can unlock. I need him awake enough to use his phone. That's it. Charlize nodded slowly. Then let me stabilize him first. You get what you want. Everyone walks away. It was a lie, but it was a useful one. The gunman stared at her, weighing the offer. Then Shiwoo spoke again, his voice stronger now. You, not one. The gunman froze. What? Shiwoo's eyes tracked toward the door, toward the corridor beyond. There's another? The words landed like a grenade. Charlize's mind snapped into overdrive. Another, not another hostage, not another victim, another threat. She turned slightly, her angle allowing her to see through the door's window into the corridor. Elias stood near the nurse's station, hands still raised. The young nurse was crying quietly. Kathy had positioned herself near the wall, exactly where Charlize had silently guided her. And near the back of the corridor, one of the two men in suits who'd arrived with Shiwu, silent, watchful, stood with his hands at his sides. Too still, too focused. Charlize's pulse quickened. The gunman's grip on the rifle tightened. "What are you talking about? You think?" Shiwu's breathing was labored, but his eyes were sharp. "You? Only one? Here for me?" The gunman's head swiveled toward the door, instinct taking over. And in that split second, Charlize saw it. The man in the suit, outside in the corridor, reached slowly inside his jacket. Not for a phone, not for identification. His hand moved with the practiced ease of someone who'd done this 1,000 times before. Charlize's training kicked in like a reflex. She didn't shout, she didn't freeze. She moved, one step backward, positioning herself near the medical crash cart. Her hand hovered near the drawer where scissors, scalpels, and emergency instruments were kept. Not weapons, but tools that could become weapons if necessary. Outside, Elias saw the movement too. His face went pale as understanding hit him like a freight train. This wasn't a hostage situation. This was a crossfire waiting to happen. The ER wasn't a clinic right now. It was a battlefield, and the patients and staff were caught in the middle of something they didn't understand. Kathy, standing near the wall, saw Charlize's eyes through the window. Wide, alert, urgent. She didn't know what was happening, but she understood the message. Without a word, Kathy gently placed her hand on the young nurse's shoulder and guided her down, quietly pulling her behind the cover of the nurse's station. The other staff members, watching Kathy's calm authority, began to follow her lead, crouching, moving toward cover, their panic held in check by her steady presence. In Ward C, the gunman turned back to Shiwu, his voice dropping to something dangerous. "Who else is here?" Shiwu's lips curved into the faintest, bloodless smile. "You. Find out." And in the corridor, the man in the suit pulled his hand free. A compact pistol gleamed under the fluorescent lights. Charlize saw it first. Her eyes locked on the weapon, her mind calculating angles, distances, cover points. All the variables she'd been trained to process in the seconds before chaos erupted. She didn't have 10 minutes anymore. She had seconds. The man in the suit didn't announce himself. He didn't shout a warning or make demands. He simply raised the compact pistol with practiced efficiency and aimed it, not at the masked gunman blocking Ward C's door, not at the terrified staff members huddled near the nurse's station, but directly at the hospital bed where Shiwu lay. Charlize saw the angle of the barrel, saw the cold focus in the man's eyes. This wasn't protection. This was an execution. "Gun!" Charlize shouted, her voice cutting through the silence like a command. Not panicked, not shrill, just loud enough to break the freeze response gripping everyone in the corridor. The masked gunman spun toward the threat, his rifle swinging up instinctively. For one suspended heartbeat, two armed men stared at each other across 15 feet of hospital corridor, both calculating who would fire first. Charlize didn't wait to find out. She didn't rush forward like a hero in a movie. She didn't try to tackle anyone or grab a weapon. She moved sideways, fast and low, slamming her palm against the medication cart and shoving it hard across the doorway of Ward C. The metal cart screeched against the tile, its wheels locking as it tipped slightly, creating a barrier between Shiwu's bed and the corridor. It wouldn't stop bullets, but it broke the clean line of sight. "Down!" Charlize barked, dropping to a crouch behind the crash cart inside the room. Outside, Elias's instincts finally caught up to the crisis. He didn't freeze. He didn't run. He dropped flat beside the gurney in the hallway, throwing his arm over the tangle of monitor cables and IV lines connected to a post-op patient, shielding the equipment and the patient from getting torn loose if chaos erupted. Near the nurse's station, the young nurse began to hyperventilate, her breath coming in short, terrified gasps. She started to stand, her panic screaming at her to run. Kathy was faster. The older woman's hand shot out and grabbed the nurse's collar, not gently, not tentatively, and yanked her down behind the heavy desk with surprising, uncompromising strength. Stay down, baby, Kathy said firmly, her voice carrying the weight of someone who would not tolerate argument. You run, you die, you stay, you live, pick one. The young nurse collapsed into a sobbing crouch, but she stayed put. In the corridor, the assassin adjusted his aim, trying to track past the overturned cart, his finger tightening on the trigger. The masked gunman shouted, "Who the hell are you?" The assassin didn't answer. He fired. The shot cracked through the hallway. Deafening, sharp, final. The bullet punched through the medication cart's thin metal side, sparking off a steel drawer handle, and embedded itself in the door frame 6 inches from where Charlize's head had been a second earlier. Plaster dust exploded into the air. The masked gunman returned fire, wild, instinctive, his rifle thundering in the enclosed space. Ceiling tiles shattered. Glass from a supply cabinet exploded outward in a cascade of glittering shards. Charlize pressed herself flat against the floor inside Ward C, her mind racing through options with cold, tactical clarity. 2 armed hostiles, multiple staff exposed, no backup yet, exits blocked by shooters. She needed to change the equation. Her hand shot out to the wall-mounted panel beside the crash cart, a small recessed box with a single red button protected by a plastic flip cover. The silent alarm. She slammed it with her palm. Somewhere deep in the hospital's security infrastructure, alarms began screaming. Silent to those in the hallway, but deafening to the control room where monitors tracked every wing, every camera, every code. Then Charlize lunged for the gurney's control panel and hit the large red emergency intercom button built into its side. Her voice came out steady, controlled, and cold as surgical steel. Code Silver, Emergency Wing, Ward C, active threat. Lockdown now. The response was immediate. A deep mechanical thunk echoed through the corridor as magnetic locks engaged. The heavy fire doors at both ends of the hallway, designed to contain smoke and fire, began sliding shut with hydraulic precision, their motors whirring with industrial finality. The assassin spun toward the nearest exit, realizing too late what was happening. The masked gunman cursed, his rifle swinging wildly between targets as his escape route sealed itself. The doors slammed shut with a reverberating boom that shook the walls. Emergency lights kicked on, harsh red strobes pulsing in rhythm with the lockdown protocol. The corridor became a segment, isolated, contained, trapped. Charlize pressed her back against the wall inside Ward C, her breathing controlled, her mind already running through the next 30 seconds. The masked gunman was now sealed inside with no clear exit. The assassin was trapped in the same space as his target, and everyone else. Elias, Kathy, the young nurse, and 3 other staff members were pinned in the corridor between 2 armed men who'd stopped caring about hostages and started caring about survival. And Shiwu, the man both shooters had come for, lay sedated and helpless on a hospital bed, separated from the crossfire by nothing more than an overturned medication cart and a nurse who'd promised herself she was done fighting. Outside in the corridor, the assassin and the gunman locked eyes across the strobing red light. Neither one lowered their weapon. Kathy's voice cut through the tension, calm and impossibly steady. "Anybody else want to make this worse?" she said from behind the nurse's station. "Or are we going to start thinking about how we all get out of here alive?" No one answered. But in the silence, Charlize heard the one sound that mattered. Sirens. Distant, but growing closer. The cavalry was coming. Now she just had to keep everyone alive until they arrived. The red emergency strobes pulsed like a heartbeat, rhythmic, relentless, casting the corridor in alternating shadows and harsh light. The masked gunman stood frozen for 3 full seconds, his rifle still raised, his head turning slowly as he processed what had just happened. He wasn't in control anymore. The hospital was. "You!" He spun toward Ward C's doorway, toward where Charlize crouched behind the overturned cart. "You just locked us in here." Charlize didn't respond. She stayed low, her eyes tracking both threats through the gaps in the cart's metal frame. The gunman's voice rose, the controlled calm from earlier cracking at the edges. "You think that helps? You think security's going to storm in here with guns blazing while you're still inside?" He wasn't wrong. Lockdown protocol bought time, but it also trapped everyone, hostages and threats alike, in a pressure cooker with no release valve. Across the corridor, the assassin moved. Not toward the sealed doors, not toward the gunman, toward Ward C. He kept his pistol raised, his movements fluid and deliberate, using the nurse's station as cover. His focus never wavered from the doorway where Shiwu lay. This wasn't about escape anymore. This was about finishing the job before reinforcements arrived. Charlize saw the shift instantly, saw the cold calculation in the assassin's posture. He was going to use the chaos, the standoff, the panic, the confusion, as cover for an execution. She needed to move the equation again. "Elias," Charlize said, her voice low but commanding. From his position on the floor beside the gurney, Elias turned his head toward her. His face was pale, sweat beading on his forehead, but his eyes were focused. "What do you need?" he asked. "The gurney," Charlize said. "On my count, roll it backward. 3 feet. Block the sightline to the door." Elias blinked, processing. Then he nodded. "Okay." "Not yet," Charlize warned. "Wait for my signal." Near the nurse's station, Kathy had gathered the scattered staff into a tight cluster behind the desk. 3 nurses, 1 orderly, all of them trembling with adrenaline and fear. "Listen to me," Kathy said quietly, her voice steady as bedrock. "We're going to breathe together. In for 4, hold for 4, out for 4. You do what I do, and you stay alive. You panic, you run, you make noise, someone gets hurt, understood." One of the nurses, a young man barely out of training, nodded shakily. "Good," Kathy continued. "Now breathe with me. In, 2, 3, 4. She guided them like a conductor leading an orchestra, her calm presence a counterweight to the terror pressing down on the room. Inside Ward C, Shiwu lay motionless on the bed, his eyes half open, his expression unreadable. But Charlize caught the way his gaze tracked her movements. Sharp, calculating, aware. He wasn't just a victim in this. He was a player, watching, waiting. The masked gunman took 2 steps toward the center of the corridor, his rifle sweeping between the assassin and Ward C. "Both of you," he shouted, his voice brittle now. "Hands up, now, or I start dropping people." The assassin ignored him completely. He advanced another step toward the doorway. The gunman's finger moved toward the trigger. Charlize saw it, saw the micro-tension in his shoulders, the way his stance shifted forward. "Now, Elias!" she barked. Elias threw his weight against the gurney. The wheels squeaked as it rolled backward across the tile, its metal frame sliding into position directly in front of Ward C's door, blocking the assassin's clean angle to Shiwu. The assassin cursed and adjusted, trying to find a new line of sight. Charlize used the distraction to move. She grabbed the rolling crash cart inside the room and shoved it toward the doorway, wedging it tight against the gurney outside. 2 barriers now. Not enough to stop bullets, but enough to break clean shots, force hesitation, buy seconds. The masked gunman's head snapped toward her. "You think you're smart?" Charlize met his eyes through the gap in the carts, and in that moment, she saw it. The way he held the rifle, elbow tucked, weight balanced. The way he scanned corners before people. The way he controlled his breathing, even when his voice was rising. This wasn't a grieving family member who'd snapped. This wasn't random violence. This was training. Military, or something close to it. "You were service," Charlize said quietly. The gunman froze. "Army? Marines?" she continued. "You move like someone who's cleared rooms before." For a heartbeat, the man said nothing. Then his voice came out lower, colder. "Doesn't matter what I was. Matters what I am now." "It matters," Charlize said, "because you know what happens next. Security's already staging outside. SWAT's probably en route. You're sealed in a corridor with no exits and 20 witnesses. This doesn't end the way you want." "It ends," the gunman said, "when he gives me what he stole." The assassin fired. The shot cracked through the air. Sharp, deafening, final. The bullet punched into the metal gurney frame with a screaming ping, ricocheting upward into the ceiling. Acoustic tiles exploded into dust and debris, raining down in a cascade of white powder and twisted metal grid. Sparks erupted from a severed electrical conduit overhead. Inside Ward C, Shiwu's heart monitor spiked, the steady beep accelerating into a frantic alarm as his pulse rocketed from the shock and stress. Beep, 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 beep. The sound cut through the chaos like a scream. Charlize's eyes snapped to the monitor, the numbers climbing. 140, 150, 160 beats per minute. If his heart didn't stabilize, he'd stroke out or code right here on the bed. And if Shiwu died, both armed men lost their leverage, and desperation became the only currency left. Kathy's voice rose from behind the nurse's station, cutting through the ringing ears and panic. "Everybody stays down," she commanded. "Nobody moves, nobody runs." The young nurse beside her was hyperventilating again, her breath coming in shallow gasps. Kathy grabbed her hand and squeezed hard. "You breathe with me. Right now. In for 4. The strobing red lights pulsed. The alarm screamed. And Charlize realized with cold, sharp clarity, the cage wasn't just trapping the shooters. It was trapping all of them in a countdown to catastrophe. The alarm screamed. Shiwu's heart rate climbed. 165, 170, 175. The monitor's frantic beeping cutting through the chaos like a countdown to disaster. Charlize moved without hesitation. She abandoned her position behind the crash cart and lunged toward the bed, her hands already reaching for Shiwu's wrist to check his pulse manually. A backup confirmation, because monitors could lie, but physiology didn't. "Elias," she shouted, "I need you in here. Now!" Outside, Elias didn't argue. He scrambled to his feet and dove through the narrow gap between the gurney and the doorframe, sliding into Ward C, just as another shot rang out in the corridor. This one didn't come from the assassin. It came from the reinforced double doors at the far end of the hallway, now breached by security personnel in tactical gear, shields raised, voices shouting commands in practiced unison. "Drop the weapon! Hands up! Now!" The assassin spun toward the new threat, his pistol still raised. He didn't fire. He wasn't suicidal, just calculating. And the calculation had shifted. 3 officers, body armor, riot shields, angles of fire he couldn't beat. He lowered the pistol slowly, placing it on the floor, his hands rising in surrender. 2 officers tackled him immediately, driving him face first into the tile, zip ties cinching around his wrists with brutal efficiency. The masked gunman backed toward the wall, his rifle swinging wildly between the advancing officers and the doorway toward C, and his leverage disappearing, his options collapsing. "I didn't," he started. "Weapon down, last warning." The gunman's hands trembled, his grip loosened. Then he dropped the rifle and raised his hands. Officers swarmed him, slamming him against the wall, disarming him with the kind of practiced violence that left no room for heroics or second chances. Behind the nurse's station, Kathy exhaled shakily, her hand still gripping the young nurse's shoulder. "It's over," she whispered. "It's over." But inside Ward C, Charlize knew better. "Elias, I need a crash cart, full kit, and I need it 30 seconds ago," she said, her voice sharp and precise. Elias stared at the monitor. The numbers were still climbing. 180 beats per minute. Shiwu's face had gone gray, his breathing shallow and rapid. "He's tachycardic," Elias said, his hands already moving toward the IV line. "Stress response, adrenaline spike." "It's not just stress." Charlize cut him off, her fingers pressed to Shiwu's carotid artery. His pulse is thready, pressure's dropping. "He's compensating for something." She pulled back Shiwu's blanket and pressed her hand gently against his abdomen, checking for rigidity, distension, signs of internal bleeding. Shiwu's eyes fluttered. His lips moved, barely forming words. "Can't. Breathe." Charlize's eyes snapped to the oxygen saturation monitor. 89%. Dropping. "He's hypoxic," she said. "Elias, I need you to prep for intubation. If his O2 hits 85, we're tubing him." Elias moved fast, grabbing the intubation kit from the crash cart, his hands steady despite the adrenaline still flooding his system. Outside, the security team finished securing the corridor. One officer keyed his radio. "Threats contained. Area secure. Medical support inbound." But inside Ward C, the threat wasn't contained. It was evolving. Shiwu's monitor alarm shifted pitch, a new, more urgent tone. Charlize glanced up. The rhythm on the screen had changed. No longer just fast, irregular. Beep, 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 beep. "He's throwing PVCs," Elias said, his voice tight. "Premature ventricular contractions. If this progresses, VTASH, then VFib, then we're coding him." Charlize finished. "Not happening, not on my watch." She grabbed the medication tray from the crash cart, her hands moving with the kind of muscle memory that came from years of high-pressure medicine. "I'm pushing adenosine," she said. 6 milligrams, fast IV push. We reset his rhythm before it degrades further. Elias nodded, holding the IV line steady. Charlize drew up the dose, checked the label twice, no room for error, and injected it directly into the IV port. Adenosine in, she announced, her voice calm but carrying the weight of command. Monitor. For 3 seconds, the world held its breath. Shiwoo's heart monitor flatlined. A brief, terrifying silence as the adenosine chemically reset his cardiac rhythm. Then the beep returned. Steady, controlled. Beep, beep, beep. 110 beats per minute. Still elevated, but regular. Survivable. Charlize exhaled slowly, her hand still poised over the crash cart, ready for the next crisis. Oxygen sat? She asked. Climbing, Elias said, watching the screen. 91, 93, holding at 94. Charlize allowed herself 1 second of relief. Then she turned to Elias, her expression sharp and focused. I need a full trauma workup. CBC, coags, lactate, chest x-ray. He could be bleeding internally, or he threw a clot from the stress. We're not out of this yet. Elias stared at her. Not at the patient, but at her. At the way she'd moved. The way she'd commanded the room with absolute precision. No hesitation, no doubt. At the way her voice had shifted when the crisis peaked. Not louder, but harder. The kind of voice that expected instant obedience because lives depended on it. You weren't just a nurse in the army, were you? Elias said quietly. Charlize didn't look at him. She kept her eyes on the monitor, on Shiwoo's vitals, on the fragile stability she'd just fought to restore. I was a medic, she said, attached to a forward surgical team. I kept soldiers alive in places where hospitals didn't exist. Elias's eyes widened slightly. Combat medicine. Charlize finally met his gaze. Her expression was unreadable, tired, guarded, but carrying the weight of someone who'd seen too much and learned to carry it quietly. Yeah, she said. Combat medicine. From the doorway, Kathy appeared, her face still shaken but her voice steady. Security's clearing the wing, she said. They want statements from everyone, but they said you... She looked at Charlize. They said you saved lives tonight. Charlize didn't respond. She turned back to Shiwoo, adjusting his oxygen line, checking his IV flow, doing the work that never stopped, even after the guns went silent. I did my job, she said quietly. But Elias saw the truth now, the calm under fire, the tactical thinking, the command presence. Charlize hadn't just survived tonight, she'd controlled it. And somewhere in the back of his mind, Elias realized something that sent a chill down his spine. If the gunman had known who he was really threatening, if he'd known what Charlize was capable of, he never would have stepped into that corridor. The corridor outside Ward C had transformed into a controlled chaos of its own. Security personnel documenting evidence, paramedics checking staff for shock, administrators already whispering about liability and protocols. Inside the room, the monitors beeped their steady rhythm. Shiwoo's vitals had stabilized. The immediate crisis had passed, but the questions hadn't. Elias stood near the foot of the bed, his arms crossed, his eyes fixed on Charlize as she methodically rechecked IV lines and adjusted the oxygen flow. Who are you? He asked quietly. Charlize didn't look up. You know who I am. Charlize, night shift nurse, employee ID 7824. That's not what I'm asking. She finally met his gaze. Her expression was tired, bone-deep tired, but guarded. I'm someone who did her job, she said. Same as you. That wasn't just doing your job, Elias pressed. The way you moved, the way you commanded the room, the way you stabilized him under gunfire. He paused. That was something else. Charlize set down the clipboard she'd been holding and exhaled slowly. I was an army medic, she said, her voice flat and matter-of-fact. Attached to a forward surgical team in Kandahar province. I treated trauma in field hospitals where the nearest backup was 30 minutes away by helicopter, if the weather was good. I learned to stay calm because panicking got people killed. She turned back to the monitor, ending the conversation, but Elias wasn't done. Why didn't you tell anyone? Because it doesn't matter, Charlize said. That was 7 years ago. Different life. Different person. From the doorway, Kathy's voice interrupted gently. That's not entirely true, baby. Charlize and Elias both turned. Kathy stood leaning against the doorframe, her arms folded, her expression soft but knowing. "I've been watching you for 8 months," Kathy continued. "You think I didn't notice? The way you never sit with your back to a door, the way you check exits before you check your phone, the way you never jump when something loud happens. You just go still, like you're listening for something the rest of us can't hear." Charlize said nothing. Kathy stepped into the room. "You weren't hiding who you were, honey. You were just trying not to be that person anymore." The words landed quietly, but they hit like a diagnosis. Charlize looked away, her jaw tight. "I left the army," she said slowly, "because I was tired of making life-or-death decisions under gunfire. Tired of the noise. Tired of carrying people who didn't make it." She paused. "I came here because hospitals were supposed to be quieter." "And then tonight happened," Elias said softly. Charlize nodded. "And then tonight happened." On the bed, Shiwoo's eyes opened fully. His gaze tracked between the three of them, sharp, calculating, fully aware now. "You..." His voice was rough but clear. "You're not what they think." Charlize turned toward him. "Neither are you." Shiwoo's lips curved into the faintest smile. "No, I am not." A knock at the door interrupted them. A hospital administrator, clipboard in hand, suit slightly rumpled, stepped inside with the kind of forced professionalism that barely concealed panic. "We're conducting preliminary debriefs," she said. "Standard protocol after a code silver. I need statements from everyone involved." Elias nodded. "Of course." The administrator's eyes landed on Charlize. "Nurse Reeves, security tells me you triggered the lockdown and administered critical care under active threat. That's extraordinary." Charlize's expression didn't change. "It's what I was trained to do." "Still," the administrator continued, "we'll need a full account for the incident report. What went right? What could be improved?" She paused. "And frankly, the board will want to recognize—" "No recognition," Charlize interrupted, her voice firm. "No spotlight, no press. I don't want my name attached to this beyond the medical record." The administrator blinked, surprised. "But I did my job," Charlize said. "That's all." Kathy stepped forward, her tone diplomatic but immovable. "What Charlize is saying is that tonight was a team effort. Dr. Elias protected patients. I kept staff from panicking. Security neutralized the threats. Charlize stabilized a critical patient. Everyone played their part." The administrator hesitated, then nodded slowly. "All right, we'll keep it internal, but we will need those statements." "You'll have them," Elias said. As the administrator left, Elias turned to Charlize, his expression thoughtful. "What did go right tonight?" he asked, from a tactical perspective. Charlize considered the question. It was the kind of after-action review she'd done 100 times overseas, cold analysis stripped of emotion. "Lockdown worked," she said. "It contained the threats and bought time for response. Communication was clear. Code silver, location, immediate action. Staff followed Kathy's lead and stayed low instead of running, which prevented casualties." She paused. "What nearly went wrong was the crossfire risk. 2 armed hostiles with conflicting objectives in a confined space. If security had been 30 seconds slower, we'd be looking at a very different outcome." Elias nodded slowly. "And medically?" "Shiwoo's crash was predictable," Charlize said. "Sedation plus acute stress plus possible pre-existing cardiac strain. The adenosine reset bought us time, but he needs a full workup. If there's internal bleeding or a clot, he's not stable. He's just stable right now." It was clinical, detached, the voice of someone who'd learned to compartmentalize trauma so it didn't consume her, but her hands were shaking, just slightly. The adrenaline finally catching up now that the immediate danger had passed. Kathy saw it. She stepped closer and gently placed her hand over Charlize's. "It's okay to shake, baby," she said quietly. "That's just your body letting go of what it was holding." Charlize looked down at her trembling fingers and nodded once. Then Shiwoo spoke again, his voice low and deliberate. "This... not over," Elias frowned. "What do you mean?" Shiwoo's dark eyes fixed on Charlize. "The man with gun. He was sent. The man in suit. He was sent." He paused, his breathing labored. "Someone outside. Wanted me dead. ER was just the stage. Charlize's stomach tightened. You're saying there's more coming? She asked. Shiwoo's expression was grim. Always more coming. The hospital's conference room felt sterile and cold. Gray walls, fluorescent lights, and a long table where administrators and security personnel sat reviewing incident reports with the kind of clinical detachment that made violence feel like paperwork. Charlize sat at the far end, her hands folded on the table, her face carefully neutral. Beside her, Elias looked exhausted. Dark circles shadowed his eyes. His normally pristine white coat was wrinkled and stained with ceiling dust from the shooting. Across from them, an unnamed hospital official, middle-aged, suit perfectly pressed, reviewed notes on a tablet. Let's be clear, the official said. This incident could have been catastrophic. We're fortunate that protocols worked and that staff acted decisively. His eyes flicked to Charlize. We'll be conducting a full review of security access points, lockdown response times, and communication procedures. What about the 2 men who came in armed? Elias asked, his voice tight. How did they get weapons past the entrance? The official hesitated. That's under investigation. But preliminarily, it appears the masked individual entered through the ambulance bay during a shift change. The other, he paused, was already inside, posing as patient security. Charlize's jaw tightened. The assassin had walked in through the front door, unchallenged because he'd looked like he belonged. We're reviewing credentialing procedures, the official continued, but I want to emphasize, no details of this incident are to be shared publicly. Patient privacy laws apply. Staff confidentiality applies. This stays internal. Why? Elias asked, an edge in his voice. Shouldn't people know what happened here? The official's expression hardened. Because naming victims, identifying attackers, and publicizing hospital vulnerabilities creates more risk, Doctor. We protect our patients. We protect our staff. We do not turn trauma into headlines. Elias opened his mouth to argue, then closed it. He was realizing something uncomfortable. His earlier confidence, the way he'd tried to assert authority over the gunman, had nearly escalated the situation. Charlize had been right. Authority didn't stop bullets. Later, in the break room, Kathy sat with a cluster of shaken staff members, nurses, orderlies, residents, all nursing cups of coffee. They weren't really drinking. The young nurse who'd sobbed in the corridor sat with her knees pulled to her chest, still trembling. I froze, she whispered. I just froze. Kathy reached over and squeezed her hand. Baby, freezing is what your brain does when it doesn't know what to do. That's not weakness. That's biology. But Charlize didn't freeze, the young nurse said. She just moved, like she knew exactly what to do. Charlize had training, Kathy said gently. Training that most of us will never need and shouldn't have to have. But you know what got us through tonight? It wasn't one person being strong. It was all of us choosing not to panic. She looked around the room. We stayed low. We listened. We helped each other breathe. That's what saved lives. One of the orderlies spoke up, his voice hoarse. I thought I was going to die. I know, Kathy said softly, and it's okay to feel that. It's okay to be scared. It's okay to shake and cry and not be okay for a while. That's not weakness either. That's being human after something inhuman happened. The room fell quiet, the weight of the night settling over them like a heavy blanket. Across the hall, Charlize found Elias standing alone near the nurse's station, staring at the corridor where the shooting had happened. The bullet holes in the ceiling had been marked with yellow evidence tags. You saved my life, Elias said, without turning around. Charlize stopped beside him. I saved everyone's life. That was the point. No, I mean... Elias turned to face her, his expression raw. I tried to talk to him, tried to use my authority like it mattered. If you hadn't stepped in... You did what you thought was right, Charlize interrupted. You're a doctor. You're used to being in control. But a hospital under threat isn't a surgery. You can't scalpel your way through it. Elias exhaled shakily. How do you do it? Stay that calm? Charlize was quiet for a long moment. I learned a long time ago, she said, that panic spreads faster than fire. One person screaming can start a stampede. One person running can trigger a shooter. But calm? Calm spreads too. Slower, maybe, but it spreads. She met his eyes. Discipline is contagious, so is control. You just have to choose which one you want to pass on. Elias nodded slowly, absorbing the lesson. They want to give you an award, he said. Recognition. The hospital board? I don't want it, Charlize said flatly. Why not? Because I didn't do this for recognition, Charlize said. I did it because people needed help. And the second this becomes about me, it stops being about what actually matters. Systems, training, teamwork. I don't want my face in a press release. I want the hospital to fix the security gaps that let this happen. Elias stared at her, something like respect dawning in his expression. Before he could respond, Charlize's gaze caught on something near the sealed double doors at the end of the corridor. She walked toward it slowly, her brow furrowing. The door's magnetic lock panel, the one that had sealed during the coat silver, showed a small maintenance sticker in the corner. Freshly applied, dated 3 days ago. Charlize crouched down, examining the panel more closely. The wiring looked wrong. Not damaged, not obviously tampered with. Just wrong. Like someone who knew hospital systems had adjusted the response time, delayed the lock by a few critical seconds. Long enough for someone to get in. Her stomach dropped. Elias, she said quietly, when did the lockdown engage? About 5 seconds after you hit the alarm, Elias said. Why? It should have been instant, Charlize said. Magnetic locks are fail-secure. The delay. She stood up, her expression grim. Someone modified the timing. Elias's face went pale. You're saying this was planned? Charlize's eyes swept the corridor, seeing it differently now. Not random violence, not a crime of opportunity. This had been engineered. The gunman came in during a shift change, Charlize said slowly. The assassin posed as security, and the lockdown delay gave them both time to get into position before the system responded. Who would know how to do that? Elias asked. Charlize turned to him, her voice cold and certain. Someone with inside access. 3 days later, the hospital administrator stood in the maintenance corridor with Charlize, a security consultant, and 2 engineers examining the modified lock panel. You were right, the consultant said, pointing to the wiring diagram on his tablet. Someone bypassed the instant lock protocol and added a 5-second delay. Sophisticated work, required system access, and knowledge of our specific infrastructure. The administrator's face was grim. Do we know who? Security footage shows a maintenance contractor badge in 2 nights before the incident, the consultant said. But the badge was cloned. We're working with police to trace it. Charlize stood with her arms crossed, her expression unreadable. Fix it, she said quietly. And fix the ambulance bay access protocol while you're at it. Too easy to slip through during shift changes. The administrator nodded. We're implementing badge verification at all entry points and adding a secondary lock delay override that requires supervisor authorization. She paused. This won't happen again. Good, Charlize said. Then she turned and walked back toward the ER, leaving the administrators to their paperwork. That evening, Elias found Charlize restocking the medication cart, the same mundane task she'd been doing the night everything went wrong. I've been thinking, Elias said. Charlize didn't look up. Dangerous habit. He smiled faintly. I was wrong. That night, I thought my authority mattered. Thought I could reason with someone holding a rifle. He paused. I almost got people killed. Charlize stopped what she was doing and met his eyes. You did what you thought was right, she said. That's not wrong. It's just incomplete. Authority works in operating rooms. It doesn't work in hostage situations. She softened slightly. You learned. That's what matters. I'm changing how I train residents, Elias said, adding crisis protocols, de-escalation techniques, recognition of when to lead and when to follow someone who knows better. Charlize nodded once. That's good leadership. Elias hesitated, then added, For what it's worth, you changed how I see courage. It's not loud, it's not dramatic, it's just steady. Charlize went back to restocking the cart. Courage is just training plus choice. You train so you know what to do. Then you choose to do it even when you're scared. In the break room, Kathy sat with the young nurse who'd frozen during the shooting. The woman looked better, less haunted, though still fragile. I keep thinking I should have done more, the young nurse said. Kathy shook her head gently. Baby, you stayed down. You didn't run. You didn't panic. You helped the person next to you breathe. That's not nothing. That's everything. But Charlize had training most of us will never have and shouldn't need, Kathy interrupted firmly. But here's what I want you to remember. Heroism isn't always big and loud. Most days, it's small. It's showing up when you're tired. It's staying calm when someone's scared. It's doing your job even when it's hard. She smiled softly. You do that every shift. That's heroism, too. The young nurse's eyes filled with tears, not from fear this time, but from relief. Thank you, she whispered. Kathy squeezed her hand. You're going to be okay. We all are. 2 floors up, Shiwu was being discharged under heavy security protocol. Plainclothes officers flanked his wheelchair, no press, no cameras, just the quiet, bureaucratic process of a high-risk patient leaving a hospital that had kept him alive despite everything. As they wheeled him past the nurse's station, Shiwu's eyes found Charlize. She looked up from her paperwork. For a moment, they simply stared at each other. 2 people who'd survived something neither would talk about publicly. Shiwu nodded once, a gesture of acknowledgement, respect. Charlize nodded back. Then he was gone, wheeled out into the night, back to whatever life waited for him beyond the hospital walls. At 2:13 a.m., the same time the shooting had started 3 nights ago, Charlize sat at the nurse's station. The corridor looked exactly the same. Harsh fluorescent lights, white tile floors, the red emergency sign overhead. The bullet holes in the ceiling had been patched, the blood cleaned, the evidence removed. To anyone who hadn't been there, it was just another quiet night in the ER. But the staff who had been there saw Charlize differently now. When she walked past, they nodded with quiet respect. When she gave instructions, they listened without question. When she restocked the medication cart, they understood it wasn't weakness or invisibility. It was discipline. It was steadiness. It was the kind of strength that didn't need recognition. Kathy appeared with 2 cups of coffee and set one beside Charlize. You ever going to tell me the whole story? Kathy asked. About what you did over there? Charlize took a sip of coffee. Not much to tell. Kept people alive. Came home. Found a quieter way to do the same job. Except it wasn't quiet 3 nights ago. No, Charlize agreed. It wasn't. Kathy sat down beside her. You know what I told the staff today? I told them that what you did wasn't about being a hero. It was about knowing what to do when nobody else did. And that kind of knowledge, that calm, it saves lives every single day, even when there's no guns, no drama, no spotlight. Charlize looked at her. You trying to make me feel better? I'm trying to make you see what I see, Kathy said. Quiet competence, daily courage, the kind of strength most people never notice because it doesn't make noise. Charlize smiled faintly, the first real smile in days. Thanks, Kathy. Anytime, baby. The monitor beeped softly. A patient called from one of the rooms. The night shift continued, steady and unremarkable, exactly the way Charlize preferred it. Because the truth was simple. No one knew the night ER nurse had served in the Army, had learned to stay calm under fire, to manage chaos with precision, to carry the weight of life and death decisions without flinching. They didn't know until the wrong people stormed the wrong ward, and even then, Charlize did what she'd always done. She stayed steady, she kept people alive, and when it was over, she went back to work, because panic is contagious, but so is discipline.